Welcome back and thank you for staying with us. Now, in Nigeria, the Medical Guild has appealed to the Lagos state government to prioritize the health and lives of healthcare workers, saying 15 doctors died within 6 months in the state. The chairman of the Guild, Dr. Saeed Ahmed, made the disclosure during a news conference ahead of the Guild's forthcoming annual general meeting and scientific conference on Sunday in Lagos. The Medical Guild is the association of medical doctors under the employment of the Lagos state government. Ahmed noted that the past year has been particularly challenging for the Guild due to the ongoing comorbidities exacerbated by manpower bleed and the attendant severe overwork among members at service points and a number of members' deaths. Now with me in the studio to discuss this is CEO Spinex Medical Resources, Dr. Adeunle Abiona. Good morning, Doctor, and thank you so much for joining me on the news this morning.
Good morning. Thank you.
All right, so can you tell us how long has the issue of poor welfare been a concern in Lagos, and has the government in any way done anything to address this issue?
Well, the issue of welfare in medical practice in Lagos has been on for as far back as I can remember. You know, there's always been this gray area over welfare, over insurance, and over the hazard allowance being paid. I mean, at some point, the Lagos state government tried to do some adjustment in salaries and take-home packages. But, you know, as the resultant effect of the inflation going on in the country, it has become more of not doing anything in the long run. So I think the problem is still on up until now, and that it has also contributed to the massive exodus that we've experienced in the health sector currently in Nigeria.
All right, now the report actually has it that 16 doctors died due to, low welfare. 15 doctors died, in the past 6 months due to welfare issues. Now, are there any ongoing initiatives to advocate for better welfare, especially for Lagos doctors?
Well, I believe one thing we should look at is how well we are able to manage our manpower. Because to be truthful, we don't have enough doctors to do the work anymore. As at 2021, the ratio of doctor to patients in Nigeria is 4 doctors to about 76,000 patients. So I mean, it's a massive brain drain, and it's telling a lot on the people who are doing the work. But for ongoing welfare packages, I really don't know of any. But I hope it won't get to the point where doctors will have to embark on another industrial strike to press home their demands, because it's becoming a little too much for the deaths coming in now. Because there are some doctors who have to overwork and do more like 24 to 72-hour shifts at a time just to make up, because there are no more doctors on ground. So I think it's something that should be looked into with urgency, yeah.
Okay, talking about this particular challenge being looked into, now we all know about the mass exodus and the brain drain in the health sector. Now, a lot of people have actually blamed, these particular challenges on the COVID-19 pandemic and how it affected it impacted the working conditions and also the welfare of doctors. Is there a possibility in any way of hiring additional doctors to address the shortage gap in the health sector?
It's so bad that I have seen some teaching hospitals go to employ final year medical students to come and fill in the gap as house officers. It's been so bad, we've seen some hospitals close down wards because there's a shortage of manpower. And I really don't think there's any help in sight for now, because the solution has to come from a policy point of view. Policy coming from the amount of money allocated to the health sector, then streaming down to administrative gaps and better welfare packages, and even better working conditions, even for doctors. Because I know some of my colleagues keep saying that even if the pay is good, the working condition is poor. So I mean, it's a long way from hope.
All right, so earlier you talked about some gray areas like hazard allowance, and welfare, of course. I really want to know, how does the welfare of Lagos State doctors compare to other states? Have similar incidents like the death of these 15 doctors occurred in other states? Have you heard of anything?
Well, the truth is, we are hearing about Lagos because Lagos is like the center of excellence. News filters out from Lagos quickly. But what happens in other states, say for example, the states in the north, it's unbelievable. I've heard of about 2 other deaths somewhere in the north, because when this exodus happens in Lagos, doctors come from the hinterland back down to Lagos to fill in the gaps. So over there's a lot of shortages, even more than in Lagos. So even when we think that the welfare package...
And how professional are those doctors from the hinterlands?
Well, I know a couple who have come from there and they haven't done bad at all.
Okay.
They haven't done bad at all. But, of course, when a doctor doesn't have what to work with, you are not better than a quack sometimes. When you don't have the necessary diagnostic tools to work with. But as well as we think that Lagos State is doing better than other states, I don't think it's still enough. That's the truth.
All right, so what are the possible long-term consequences of poor welfare, for doctors? And, what measures do you think the government should actually take in Lagos State to be able to sort this issue out?
Well, long-term consequences will mean more hemorrhage in the health system. Doctors will keep leaving. Some doctors will stop practicing. If it's not getting profitable, they go into other ventures. And long-term solution, as I said, has to be policy-driven, because the Lagos State government will not pay more than what has been allocated from the budget to its doctors. And I think, as I said, policy, something has to change from the top. Something has to change from the top. That's the only way I think we can get something done.
I will thank you so much, Doctor, for joining me to speak on, this particular issue. Thank you. We appreciate you for your time.
Thank you. You're welcome.